This topic is neurogenic shock. Okay, let's take a moment, and I want you to remember something. Sympathetic nervous system, spine constrict. Parasympathetic nervous system, relax and dilate. Sympathetic, parasympathetic. That's going to help us later on. So neurogenic shock. This is a distributive vasodilatory shock. This is a redistribution of the intravascular fluid due to loss of sympathetic tone, which results in relative hypovolemia. So what does that really mean? What happens is there is massive vasodilation and blood pools in the periphery. The parasympathetic system takes over and everything relaxes, and the sympathetic system isn't allowed to respond. So it results in relative hypovolemia because the fluid in the body is in the periphery. So the blood is not getting back to the heart to be oxygenated and be sent to the rest of the body. That results in decreased cardiac output, decreased tissue perfusion, and then altered cell metabolism. Causes include spinal cord injuries, normally at the T4, T6 level, because at this level, it causes vasodilation, pooling in the periphery, because an injury at this level causes a loss of sympathetic nervous system response. It can also be caused by severe brain injuries or spinal anesthesia, because that spinal anesthesia can cause a disruption in the transmission of the sympathetic nervous system. And certain medications, like opioids, which depress the vasomotor center in the brain, causing peripheral vasodilation. Whew, that was a lot of information. Let's break it down to even smaller parts. Neurogenic shock is the disruption of the sympathetic nervous system. That causes a loss of sympathetic tone, which results in venous and arterial dilation. That causes a decrease in the venous return. Less coming in, less going out. That causes a decrease in the cardiac output. So less is going out to the body, causing impaired perfusion and impaired cellular metabolism. So remember, parasympathetic nervous system, everything dilates and relaxes. So the clinical manifestations that we're going to see are from parasympathetic stimulation, massive vasodilation. So we're going to see hypotension. And then the client's periphery will be warm, but only to start. And we'll talk about that in a second. And then the client will have bradycardia. That's a little bit different than all the other shocks that we've talked about so far, right? But it's because that parasympathetic has taken over and it is unopposed by the sympathetic. So the parasympathetic is causing the heart rate to slow down, and it's not allowing the sympathetic nervous system to come in and make it beat quicker. So remember, I told you that the clients will have warm, dry skin in the periphery, but only initially. That's because that blood will push out to the periphery and it's warm to start, but then it dissipates and then the client becomes hypothermic. The client will also have changes in level of consciousness. They might be agitated or restless due to decreased perfusion. Now, depending upon the cause of the neurogenic shock for a particular client, you may see paralysis or weakness at or below the level of a spinal injury, or loss of bladder and bowel control. Let's take a second and look at this illustration, which shows you vasodilation, that blood vessel diameter increasing, so blood flow is allowed to go quickly through that area, but it isn't constricting back down and the blood pressure is lowered. Nursing interventions. We want to stop shock in its tracks. If a client is at risk and starts to show clinical manifestations of neurogenic shock, we need to take action. We want to help return the sympathetic tone. But first we need to stabilize that spinal cord injury if the client has one. You can see here in the image the use of a hard cervical collar. We want to protect the client's airway, and then we want to stabilize the injury to prevent further injury or permanent disability. Then we want to treat hypotension and bradycardia. We can elevate those legs to help venous return, getting that blood back to the head and to the heart. We can provide an IV fluid bolus, but we have to be very careful because remember, it's relative hypovolemia. They haven't lost any fluid, it's just not going in the right direction. So we want to make sure that we don't give too much fluid to give them fluid overload. We'll give vasopressors to help constrict the vessels and increase blood pressure. We'll give positive chronotropic drugs for bradycardia, and we'll provide supplemental oxygen. We can maintain their core body temperature with warming blankets, and then the client will be on cardiac monitoring so we can look for arrhythmias and treat them quickly. We'll monitor their level of consciousness using the Glasgow Coma Scale. This is used for clients who have had a brain injury. This will help us to determine if our interventions are helping or if the client is worsening. And if this client is worsening, we may have to prepare them for intubation and mechanical ventilation. And we'll also want to prevent urinary and bowel retention. Okay, neurogenic shock. The parasympathetic nervous system is unopposed by the sympathetic nervous system. You got this. Keep up the good work. I'm proud of you.